Let's look at the arteries of the abdomen. The first thing you'll notice in the arteries of the abdomen is that you have the abdominal aorta coming down here in the wireman. As you look deeper, the very first branch that comes off of it right here is called the celiac trunk, right? The celiac trunk is deep inside right here. In terms of the number, it's really hard to see, so I can't give you a number on that. The celiac trunk is going to divide into three main branches. One that goes right to the kidney, the liver, right here, right? That one, as it goes to the liver, goes up and into the liver, is called the hepatic artery. The next one goes around and it goes into like a circular area, following the outline of the stomach. Number 86, right, is one of the branches. That's a gastric artery. The last one actually goes just to the left immediately. That left one is number 90, right? And it goes right to the spleen. This is a splenic artery. Now, the splenic artery has a splenic vein that goes with it, number 55, right? Now, the gastric vein, number 49, also follows the gastric artery. Now, the special thing about the hepatic vein, we're going to see in a second, right? It actually receives more than blood from just the hepatic artery. So as we move down a little bit more, you see the second branch coming outwards. The second important anterior branch, right, is number 93, and that is your superior mesenteric artery. It supplies blood and nutrients to the right side of your small intestine and your colon, right? The superior mesenteric vein, number 50, runs alongside with it, and we're going to see the superior mesenteric vein, the inferior mesenteric vein, the splenic vein, all are going to fuse together to form the hepatic portal vein, which we'll talk about in just a second, right? The abdominal aorta continues downwards, and one of the things you do see are these small little projections right here, right? These little arteries are actually not part of your abdominal aorta. These arteries are your gonadal arteries, either the ovarian or the testicular arteries when we start talking about the gonads right here, right? The big area right here, the abdominal aorta continues. As it continues, there's a last branch to the left right here. This branch is your inferior mesenteric artery, number 94. All right, the superior mesenteric artery allows you to bring nutrients to the right side. The inferior brings nutrients to the left side of your small intestines and your colon. This inferior mesenteric artery comes out and it has a superior mesenteric vein, number 52, that runs with it. Now, I'm going to bring this together just to show you right now what happens in the abdomen. In the abdomen, the inferior mesenteric vein, the splenic vein, so 52 inferior mesenteric, splenic vein 55, they fuse together and they cross. As they cross over to the opposite side of your abdomen, it receives number 50. Number 50 is your superior mesenteric vein. The superior mesenteric vein and the combination of splenic and inferior comes over and it turns into number 48, which is your, right? Number 48, which is your hepatic portal vein, right? Now, one of the things you do notice is that one of the branches of the abdominal aorta goes laterally and posterior. This is your renal arteries. Renal arteries goes to the kidneys. The abdominal aorta continues downwards after giving rise to the inferior mesenteric artery, and then it will then branch to the common iliacs.